Hi everybody, here we go with Chapter 11, Voice Disorders. So, voice is the complex dynamic product of vocal fold vibration that allows us to vocalize and verbalize. And we talked way back in Chapter 1 about how amazingly complicated speaking is. And voicing is certainly all by itself is really complicated, that we're vibrating our vocal folds more than 100 times a second. In order to, have voice sounds, unvoiced sounds, voice sounds, unvoiced sounds. It's amazingly complicated, just the voicing aspect of this. And then we've got two different states of the vocal folds. They can be adducted, adducted, the state in which the vocal fold muscles are closed, so they're active. So when they're closed together, we're vibrating, they're touching, and helping to make sound. And then they can be abducted, abducted, the state in which the vocal folds are open or at rest. So as you're sitting listening to this, not talking, just breathing, your vocal folds are abducted. While I'm talking right now, they're coming together for the voice sounds, and they're adducted. A voice disorder is an individual whose pitch, loudness, or phonatory quality differs significantly from that of persons of a similar age, gender, cultural background, and or racial or ethnic group, or anybody whose voicing actually hurts would also fall into that category as well. So just some terms here. Dysphonia is the umbrella term used to refer to a voice that is disordered in some or any way. And then aphonia refers to the total loss or lack of voice. So remember, if that A is in front of it, aphonia is a lack of voice, aphasia is a lack of language. So aphonia is a complete loss or lack of voice. Whereas dysphonia is just a voice that is disordered in some way. Vocal fold functioning. Hypofunction describes vocal folds that are under-functioning and have inadequate tension, right? So somebody might have a really breathy voice where they're not able to get their vocal folds together to have adequate tension, and then they're not where they need to be. And they're not able to make the type of sound they want to make. And then you've got hyperfunction. Vocal folds are overly tense and can press together too tightly, right? They're squeezing together, forcing together, and hyperfunction over long periods of time can lead to voice, to more severe voice disorders. And then we've also got diplophonia, which means a double pitch, and describes a vocal quality in which the vocal folds produce two different pitches simultaneously, right? So they're going to be hyper and hypo at the same time. So they're going to be rough, but then also breathy at the same time. We've also got voice without a larynx, right? So a laryngectomy is a procedure in which a person's larynx is surgically removed, most often due to cancer, throat and neck cancer, and that most often is going to be caused by smoking. Not always, but it's going to be the most common denominator in the cause of a laryngectomy. And laryngeal communication is a form of communication used by people who have no larynx. So they can either use an external device that they can press on their throat while they're talking to help produce some vibration to help get more typical speech, or they can learn to create speech and some vibration without the vocal folds, but that's really difficult to do. Voice disorders in adults. Let me make sure that's where we are. It is. Okay. The prevalence and incidence is relatively high compared to other disorders of communication. So the prevalence is about 29%. So when we're talking about prevalence, is if you ask somebody who's an adult, have you ever at any time in your life had a voice disorder? almost 1 in 3 people will say, yes, I had laryngitis, or I really overused my voice and I, couldn't speak, or something like that. So it's really high. The incidence is about 6%. So how many people have a voice disorder right now currently? How many adults? Is about 6%. And that's higher for women than for men. It may be the only disorder that we'll deal with as speech and language pathologists where the incidence is actually higher for women than for men. And we'll, the reason for that we'll talk about is that, a lot of times it can be due to overuse of voice, and more women are going to be teachers than males, and that's going to be really the big reason why we're going to see that. And then other things like cheerleading and things like that can also lead to a voice disorder. The most common causes of voice disorders include vocal nodules, edema or swelling, polyps, carcinoma, and vocal fold paralysis. The prevalence and incidence of children is about 4 to 6% of children have significant problems with their voice. About 4% of 2 to 6 year olds have problems with hoarseness. Dysphonia among 8-year-olds occurs about 6% of the time, 7.4% for boys, 4.6% for girls. The most common cause stems from vocal nodules, which are little bumps on the vocal folds that don't allow the vocal folds to close all the way. And, often this is due to overuse. Sometimes if you're at the playground, there can be one child who just yells and yells and yells and yells, and they yell a lot. And that slamming together the vocal folds over time can produce a nodule on their vocal folds that can lead to a voice disorder. So vocal abuse, the chronic or intermittent overuse or misuse of the vocal apparatus. Abusive behaviors, talking in noisy environments, coughing or clearing the throat frequently, using too much caffeine. I'm in trouble for that one. Yelling, screaming, or cheering. Just thinking, I've been watching a lot of the college basketball games recently, and you hear the coaches after the game and they can hardly speak, because of they've been yelling the whole time. And they'll be interviewed after the game and, I'm really proud of our team. We really rebounded really well. And they have a really hard time producing voice well, as they've been yelling and screaming in a noisy environment for the last 2 hours. Again, we can cheering, so it can occur in cheerleaders as well. Giving speeches or lectures, so teachers are going to be at risk here. Spending time in smoky environments can also lead to voice difficulties. So vocal nodules, sometimes called teacher's nodules or singer's nodules because of their increased prevalence among these professions. And again, more women are going to be teachers than men, and I believe more singers are going to be female than male as well. So that's going to be big reasons for the increase among females to get vocal nodules. There are 2 types, the acute, so essentially bruises on the vocal folds. So if you just kind of have short-term abuse, your vocal folds become bruised. As long as you rest your vocal folds, you drink water, you talk quietly and not very often, they'll go away. But over time, these can become chronic. So acute bruises thicken and harden into hard lumps on your vocal folds that may have to be then surgically removed if this is a chronic issue with yelling or abusing your voice in some way. All right, contact ulcers and granuloma. Contact ulcers are inflamed lesions that develop on the arytenoid cartilages in the posterior region of the larynx. So in the back of your larynx, you get these really inflamed lesions on there. And then granulomas are a mass of tissue created by the body at the site of the ulcer to help the healing process. So a granuloma is a hard mass of tissue that then surrounds the contact ulcer. That again makes it even harder to speak, but that's actually the body healing the ulcer. But that's a whole nother problem as well. And then we've got GERD, gastroesophageal reflux disorder, commonly sometimes called heartburn, indigestion, acid reflux, a condition in which acid from the stomach backs up into the esophagus. A few years ago, we had a professor in a different college come into our speech and hearing center who had really difficult acid reflux. And he did some vocal activities, but the big thing for him was changing his diet. So he cut way back on caffeine, and he started eating really differently. He never ate at night. When he wouldn't eat within 3 hours of laying down for bed, and he drank a lot of water, and he changed his diet. He changed what he ate, and it completely took the acid reflux away. He had been on medication. He had been overweight. He lost weight. He didn't have to be on any medication. So really the dietary changes and the times in which he ate and how much he ate had a huge impact on him for his gastroesophageal reflux disorder. Neurogenic disorders result from illness, damage, or disease to the neurological systems associated with vocal production. Both the central nervous system and the peripheral nervous system are involved. And when we're talking about the vocal folds, we're really talking about the vagus nerve, which is really a nerve that runs throughout the body and impacts a lot of different functions that we do. But the vagus nerve is really involved in the vocal folds. So types of disorders that are classified as neurogenic disorders are going to be vagus nerve lesions, spasmodic dysphonia, ALS, Parkinson's disease, iatrogenic etiology. Iatrogenic refers to anything that's medically caused. So if you have to have surgery and you're intubated with a tube and your vocal folds aren't completely open and that tube scrapes on your vocal folds, that can lead to a voice disorder. Also, you can take medications that might really dry out your vocal folds. That would also fall under the window of iatrogenic because it's medically caused. And then vocal tics and Tourette syndrome. If you have people who have a vocal tic where they're slamming their vocal folds together harshly often, that can lead to a voice disorder as well. Psychological or emotional triggers. So psychogenic disorders, also called non-organic disorders, result from or are linked to emotional and psychological characteristics. So if somebody has a big psychological trauma, they may lose their ability to voice for a little while until they are able to usually work through that trauma either with counseling or just in time. And once the trauma goes away, the voice disorder will go away as well. And then also, and kind of related, once injured, many patients have an anxiety or sense of vulnerability associated with receiving the injury again. So if somebody has a voice disorder and they recover from it, it heals, but they might still be really afraid to use their voice because it hurt or they didn't like how it sounded, and so they're still really breathy because they don't like how their voice hurt before. So they don't really have anything wrong with their voice anymore, but they still have that anxiety or sense of vulnerability from when they had that voice disorder before. And so they're changing how they use their voice. So it's not a physical disorder, it's more of a psychological trigger. So psychopathology, subcategories: stress, anxiety, depression, acute stress disorder, generalized anxiety disorder, and performance anxiety or stage fright are all going to be things that can be linked with voice disorders. And again, usually if the anxiety, depression is dealt with, the voice disorder will resolve as well. You also have the idea of conversion disorder. So conversion disorder is when a psychological disorder or a psychological trauma, the person converts that into a voice disorder. So somebody is in a really psychologically traumatic experience, they may lose their voice for a certain amount of time. And again, once they work through that trauma, with or without therapy, their voicing should come back. All right. Then we've got mutational falsetto and juvenile voice disorder. Mutational falsetto or puberphonia describes a male child or adolescent who exhibits an inappropriately high voice. So if we have a 9-year-old boy who speaks like a 9-year-old boy, he'll probably be really happy with that voice. If we have a 22-year-old man who speaks like a 9-year-old boy, he might not be happy with that voice anymore. So he's got that sort of higher pitch of a child, and may then want to work on his voice to make it deeper and richer, and sound more like the person he perceives himself to be. Likewise, for women, juvenile voice disorder is a disorder in which women maintain a juvenile voice into adulthood. So again, you can have a 9-year-old girl who speaks like a 9-year-old girl and is perfectly happy with the way that she speaks. But then you can have a 23-year-old girl who still speaks like a 9-year-old girl, who may or may not want to continue speaking like a 9-year-old girl. So has a higher pitch, and things like that, maybe some squeak in her voice. And then again, it's completely up to her. I mean, there's nothing really, as long as the person's not harming their vocal folds, people can talk however they want to, but they may choose to come in and want to talk more like the average 23-year-old woman or the average 23-year-old man. And usually these things are pretty easy to change if the person desires to do so. Then we've got Laryngeal Communication. So remember that A, so there's no larynx. Some individuals must produce voice without the benefits of a larynx. This is Laryngeal Communication. This can be through a tracheostomy, the removal of the entire trachea, or a laryngectomy, the removal of the larynx. Again, often due to throat or neck cancer. And we've got cause and symptoms and treatment, and I posted some videos for you up on As You Learn, so please check those out and look at those. A voice disorder impacts one or more of the following perceptual characteristics of voice. It can impact resonance, pitch and loudness, and or phonatory quality. Resonance, right, is all the changes in sound that we make after the vocal folds. So the vocal folds vibrate, and then we use our mouth and our nose to create this rich sound when we're speaking. Velopharyngeal inadequacy occurs with imperfect closure of the port because of structural or muscular problems. So you may not be able to close off the air going to your nose because of cleft palate and craniofacial anomalies, right? So somebody who has a cleft palate may have lots of air going up through their nose. I'm not able to close off my nose and have lots of air coming out while I'm talking, right? So that's going to really change the way the person sounds and presents themselves. We've got that iatrogenic problems again, so something with a medical cause can be the cause of this. And then we've also got allergies, right? I've had a lot of allergies lately, so I'm much more hyponasal than I am all the time. It's the beginning of spring right now, and we've got pollen coming up, but then also we've got the heater on, so things are drying out and pollen at the same time, and it's just a bad combination. So, if you were completely hyponasal, you'd have no sound coming out of your nose at all, and you might sound like that. But often, we're somewhere. If we have allergies, we're somewhere in the middle between regular nasality and hyponasality, right? And then we've got a neuromuscular impairment where the person's not able to raise and lower their velopharyngeal port, so that either they're completely hypernasal or completely hyponasal, depending on where that port is stuck. All right, pitch and loudness. We have got... let's talk about pitch. So habitual pitch is the pitch used in normal speaking situations without applying any extra effort. So wherever your pitch is when you're just talking regularly. Optimal pitch would be the pitch at which one's voice production is the least abusive, least effortful, and most efficient. So at what pitch are you the most gentle on your vocal folds, and yet you also sound the best? The basal pitch is the pitch at which you can be the lowest pitch, but yet still have, still not be hurting your vocal folds and not have any vocal fry, which we'll talk about in a second. Ceiling pitch is the highest pitch at which you can talk without injuring your vocal folds. And then the space between the basal pitch and the ceiling pitch, so the low pitch, you might be at 90 vibrations per second, and then your ceiling pitch, if you're a man, might be 140 vibrations per second. So that 90 to 140 would be your vocal range, right? Where you can be without hurting your voice, without breaking your pitch. And we can talk about vocal fry, which the pitch is unusually and chronically low, with tight vocal folds and sounding like a poorly tuned motorboat engine, right? So, I think we should go out and do, right? So that's going to be vocal fry, where you're so low, you're kind of grinding your vocal cords. And then we can talk about loudness. So monotone loudness is speaking in exactly the same loudness all the time, and there's no change at all in how loud we are, and we don't even think about it, but as we're talking, we get quieter, we get louder to stress some things, and if you're not getting any louder to stress syllables, it can just sound different, it can sound boring. So we want to have some differentiation in our tone. And you can also have people who are under loud and who speak really quietly, and for whatever reason are not able to speak at a sort of regular loudness. And that can also it can actually be easier sometimes to speak louder, and it can feel good to speak a little bit louder and use your full voice. So that's also something that speech pathologists will work on. And there's a cool video on that I posted for you about helping people get louder who struggle with that, and how helpful that is for them. Right. So then we've got phonatory quality. Phonation is the production of voice via the vocal folds, which we know, right? And there are several common disturbances, right? So that we could have a hard glottal attack where the voice is produced with a hard vocal burst, where you build up air pressure below the vocal folds, tense them together, and then they explode out. So when we're talking like this and really forcing, excuse me, that's hard to do. And then glottal fry, like I talked about before. Sounds like a frying pan a little bit. Breathy phonation where I can't get my voice going. All right, so if I'm breathy, I'm not fully bringing my vocal folds together. There's either something in the way, like a lump or something like that, or I'm just not, forcefully bringing them together enough. Spasticity, where the voice is produced with too much vocal tension and effort, so kind of the opposite of breathy, resulting in the intermittent stoppage of voice. And then hoarseness is produced with extra noise. So, we had a really hard time, and we were. It's going to be hoarse, where again we get extra noise back there with the sound spectrum. And that is it for this lecture. You are still responsible for the assessment and treatment of voice disorders, which I think is about the last 6 pages or so of the chapter. So you can read that and check that out. And I hope you all have a really good week.